Hi there, everybody. Welcome to our Facebook Live today. Today, we are so excited to have Susie Touchinsky joining us live to share some wonderful information, tips, and strategies, all things driving today. So, Susie, welcome.
Thank you so much for having me. I'm really excited to be here. I'm a big fan of the BCAT, the whole system, so I can't wait to talk about it.
Yay. Well, we're excited to have you, and we're really looking forward to hearing all about the resources and the services that you provide to your clients out there. So let's start off, Susie. Just tell everyone a little bit about yourself, your background. How did you get started in the realm of driving?
Okay, yeah. So I am an occupational therapist. I've been an OT for over 20 years, and I started in driving rehab in 2003 when I was working at Johns Hopkins. I've kind of fallen in love with it and have been in and out of it over the years. But most recently, 3 years ago, I opened my own private practice, Adaptive Mobility Services. In that practice, I work with clients looking to return to driving or needing guidance on driving or needing adaptive equipment. And I also educate occupational therapy practitioners interested in doing driving rehab. So it's two different arms. It keeps me really busy. And honestly, the BCAT is a big part of what I do, both with my clients and the OTs I work with.
Interesting. Well, congratulations on your practice. It sounds really wonderful. Tell us a little bit about how you are using the BCAT in your own practice and how it's giving you the information that you need with your clients during your assessments.
Okay, so as I mentioned initially, I started at Johns Hopkins, which in the late 90s, early 2000s, for me at least, my experience was all about the mini mental status examination.
I remember the mini mental.
Yeah, I got to work with Dr. Paul McHugh. He was one of my attendings. And so every day we were eating, living, breathing the mini mental on the psych ward. And throughout the years, I became more and more interested in driving rehab. And my focus has often been cognition. I was partnered with the memory clinic. And at Johns Hopkins, you just see all kinds of really interesting conditions, right? So I'm always digging. Where's the next assessment tool? Where's the next resource? So I think it was, and you might have to help me with the dates, but I feel like it was like 2008, 2010, I became familiar with the BCAT. Could that be accurate?
It was probably somewhere around that time.
And I was working for a different rehab company. I was living in Pennsylvania, but we were looking for an assessment tool that would really look at the skills needed for IADLs, instrumental activities of daily living, that would go beyond memory, that would go beyond, short-term memory and recall, and really challenge that attentional capacity and executive functioning skills. And I remember meeting Dr. Mansbach at an AOTA conference, learning more about the tool, and I just dove right in and fell in love with it. So in my practice, when I started my business in 2018, it was one of the first things I'm like, well, I have to have the BCAT system. This is a must. This tool is so great for looking at what the higher functioning skills that I need to know before I get in the car with someone. So in my practice, just to back up a little bit, what I do is as a driving specialist, I go to my clients' homes and I perform comprehensive driving evaluations. That includes sitting down with them before we get in the car to look at their vision, how they're moving, and how they're thinking. Cue the BCAT. And then I get in the car with them to see how the patterns are
right there.
See how the patterns are playing out, and then we talk about the outcome. So when I'm sitting down with someone, cognition, the first thing I pull out is one of my BCAT tests. And depending on their medical diagnosis, it guides me. Am I doing the full assessment? Am I doing the short form? So for example, yesterday I had a 45-year-old gentleman with multiple sclerosis who is coming to me because he needs adaptive equipment for losing sensation in his legs and his feet. I'm pulling out the BCAT short form. I'm doing the 21-point questionnaire. I'm going through it to see, I basically say to him, I'm screening you, right? I'm using this screening tool. You're working, you're high functioning. I get it, but I want to just double check, right? So that's one example of how I use it versus anyone who comes to me with a diagnosis of mild cognitive impairment. Sometimes I just get cognitive impairment, dementia, frontal temporal lobe dementia. I see people all the way along the spectrum. Those are the people I'm diving in with the full assessment, using the 50 points, start to finish, full BCAT to really understand this person. And what I really love about this tool is, one, of course, it gets at working memory and recall. Great, fantastic. But it gets into attentional capacity and executive functioning. And those are two really big key points when we're talking about, do you have the fitness to drive? Because a lot of us.
So Susie, tell us more about that. Tell us how attention and memory and executive function, how those skill areas are really relevant to being able to drive, on the road safely from day to day.
Right. So with driving is an overlearned behavior. And a lot of times, have you ever been in this situation where you're thinking, I drove home from work, but wow, how did I get here so fast? It's because
yes, you don't even remember driving.
It's because a big piece of driving is an overlearned behavior. The motor skills can be overlearned. Even our visual search habits can be overlearned and become a pattern. But what's important for driving is noticing and responding to the changes in the driving environment like that, right? So even when you're kind of that's not the right word, but autopilot, noticing when the traffic in front of you stops, so you can quickly respond. Dividing your attention when you have to change lanes so that you can look at the traffic in front of you while looking at the people in your blind spot. Making decisions when it comes to making an unprotected left turn. What's going on to the right, what's going on to the left, bringing all the timing together. So there's a lot of different maneuvers that we perform that we pull on those higher level cognitive skills.
And I feel like you do those really quickly, right? There's not a lot of time to make those decisions. You're kind of instantly adjusting, braking, turning. It sounds like, those things have to really be in place at full capacity to be able to function in a driving situation.
And they have to come together all at once, right? So when I'm sitting down with them in the clinic or the kitchen table, because I'm in their homes, before we get in the car, I'm individually looking at the skills, the vision, the reaction time. I use a brake reaction tester, the skills with the BCAT, and then I can use those to start to find a pattern in the changes with the person. So it's what's interesting, and we should do a study on this, is looking at BCAT scores comparative to brake reaction time.
Ooh. Something to think about.
Yeah, I'm always up for a research study. But it's interesting because we have to see it, we have to think it, we have to do it. And that's what driving is. And we can see changes in the thinking and the doing, that processing component, the different, executive functioning pieces coming together. That's when I am really thinking, okay, is it time to stop? Because if we think about the person with a cognitive change, my role, a lot of times we're seeing people earlier and earlier in their disease, right? Doctors are doing a better job of identifying it earlier. Family members are doing a better job of not just saying, oh, grandma's getting old, Right. We're doing a better job of it. So I'm seeing people earlier in their condition. And my job as an occupational therapist and driving specialist is to see what are the flags and to get them off the road before there's a problem, while not being overprotective, right? Or overly cautious.
Finding the balance.
Balance those pieces. So one of my favorite components of the full assessment, the full brief cognitive assessment tool, is that when I put that information into the computer, I not only get a contextual memory factor, definitely important, I get that executive functioning score. And that is huge for me. I have a really cool case, if I've got a minute for that, right?
Sure, of course, share.
Okay, so one person that I worked with, She is a retired nun, and she was a school teacher. She would teach, young students. And so like memory. She even told me she went to like a memory training camp, which was really interesting. I'd never heard of that, but apparently it's like something
I'd like to know where that was.
40s or 50s. I'm not sure. Never found out. I don't know. But I'll see there's some people that have awesome memory strategies. They've learned these over the years. So with her, I remember her clearly. She scored a 41 out of 50 on the brief cognitive assessment test, but her executive functioning score was really low. And her MCI
was a warning sign.
Yes, she came in with executive functioning MCI, and on the road, I'm telling you, she was having trouble. She could find when to make, like if we're making a left turn, she knew when to make the turn, but she couldn't execute it in a timing in a way that was safe. Or as things got more complicated, she had trouble task shifting, and she'd forget things like looking in her blind spot or using her turn signal. She backed out of a spot without looking for a pedestrian, and there was someone walking behind us.
Thanks.
Right. So
those are, I really like those examples you're sharing, because it really brings, pulls together the BCAT box scores, that contextual memory factor score and the executive function factor score, how that information is predictive, but then how you see it playing out during a functional task.
And it's huge. So, it's huge for me because it really, really clues me in. And I'm a little embarrassed to say I wasn't using that information probably until about 4 years ago when I retook the training modules. And I was sitting with Erin Kneffel, and she said, this is how you can use this. And I'm like, oh, light bulb, huge. So interestingly enough, comparative to, like, I had another gentleman just the other day. He has cognitive changes. They're not sure what's going on. We're watching him. The neurologists are starting to send them to me because I'm using the BCAT and they're getting information. And his scoring came out more MCI undifferentiated. He had memory deficits for sure. Like, the recall. He had trouble recalling the forewords. He had trouble recalling the pictures. But we went through the story piece, and his recognition was spot on. And actually his executive functioning was spot on in most places, and his visuospatial. So for him, he actually demonstrated to me fitness to drive, and he's going to continue with monitoring and check-ins I think the neurologist said, I'd like you to check in every 9 months. No problem. Versus the nun who actually scored higher on the test, but performed worse in the car, and she's transitioning to driving retirement. So it's just like, and as we get scores all the time, right? As clinicians, we like to share scores and information. There are certain tests and measures. I'll get, like, it's not uncommon, the neurologist will say, well, they got a 15 out of 30 on the mini mental. And I'm going, oh, geez. They probably don't need me, versus like a 28 out of 30. That's going to guide me. But whenever someone has used the brief cognitive assessment tool, I want the report. I want the computer printout. I want to see what's going on, because there's so much information in there that helps to guide me and give me confidence in those gray areas.
And I think these are really good examples of how utilizing the BCAT test system and using it online, using the online test report feature, getting those comprehensive, detailed, patient-specific reports really helps to guide your diagnostic skills, your treatment planning, the interventions you might select. It really does help, give you that patient-specific information you need to set up the plan that you need to execute to help each individual client that you serve.
Oh my gosh, it's amazing. And I have gotten to the point, so I've been doing the BCAT everybody gets some form of it with me. And so, I can anticipate how scoring's going to go. So I don't always do it real time, but when I'm writing my report, I always include the printout back to the physician. And from a marketing standpoint in my private practice, this has been huge. The physicians love it. They love that I'm, one, using a tool that not everybody else is using. And I mean, they were impressed that I was willing to invest. It's not a lot to invest, but, you know, to use the tool, right? Which I think is really important as practitioners. If we want to differentiate ourselves, we shouldn't just be pulling something offline that everybody can use. So why is this person coming to me? How can I use my skills and expertise? And I am really loving the combination of the BCAT with an OT-based tool called the Assessment of Motor Process Skills. The two of them together, I'm like, wow, now that's also another study we could do, because it's going to be,
Well,
we keep looking for like the holy grail with driving, and this Assessment of Motor Process Skills looks at performance-based functional, you know, outcomes and performance, compare, and then pull in like a formal test like the BCAT. I kind of feel like I could do those two things and be comfortable taking somebody on the road and knowing what's going to happen.
Yeah, and I think that brings up another really excellent point, is that the BCAT test system is, in your practice, a good first step. It doesn't mean that there may not be other things you're pulling in for your comprehensive driving assessment, but it's definitely going to give you the information you need about cognition and help set your organization apart from other, you know, competitors in the area. Susie, we're almost out of time.
I'll tell you the other thing.
I was just going to ask you, it sounds like you get a lot of referrals from different sources. If people wanted to reach out to you, to your website, or interested in having a driving assessment, how would they gain access to you, and what would be next steps?
Oh, thank you so much. I am available. I'm online, so adaptivemobility.com. I am very passionate about partnering, not just with practitioners, not with just with doctors, but also practitioners. So I also offer free education to OTs and really anyone. You can go to adaptivemobility.thinkific.com, and I can post those underneath here. And there's a really cool, there's a recording I did with Dr. Mansbach on there as well, if you guys want to see the tools and we talk about an OT approach. Before we go, I wanted to say, you know, from a referral standpoint, I love when OTs, PTs, speech therapists working with the clients, you know, in the outpatient, inpatient, wherever they are, home health, use the BCAT. It's a great screening tool for me to use to see if someone's ready for the driving eval, which is huge for like saving money and giving people the appropriate things they need at the right time. So I'm all about that. And if I can help, I'm happy to help any way I can. You can email me. My email's on my website too. Call me. I'm around. I'm happy to help.
Well, those are all really great suggestions. We so appreciate you taking the time today to share your expertise, your knowledge, give us this nice overview all about driving and how to integrate the BCAT test system into your assessment package, as well as how to, if you're out in the field and driving might be something that's on the radar of your patients or families, you're concerned about driving retirement issues, how to connect to you and take those next steps to make sure each and every person is safe out there on the road. So thanks so much for joining us today. We really appreciate having you, and
thank you, Lynn.
Good luck with your practice. Thanks so much. Take care. Bye-bye.
Bye, guys.